Now we will begin Triage Cancer's webinar on Unpacking Cancer from the Backpack, how to help kids and teens thrive at school when a parent or loved one has cancer. My name is Madison McMahon Ward, and it is my pleasure to introduce today's speaker, Carissa Hodgson. Carissa Hodgson is the Director of Programs and Community Outreach at Bright Spot Network, which provides a program of support to parents with cancer who have young children. She has over 14 years of clinical and program experience working with families facing cancer. Prior to her position at Bright Spot Network, she was the program manager at Gilda's Club Madison for 13 years, and her professional passion is supporting kids and families who are navigating cancer, shaped largely by her father having lung cancer when she was a child and her stepfather's diagnosis of liver cancer when she was a young adult. If you would like to read more about Carissa, I encourage you all to do so on our website. And with that, I'd like to turn it over to Carissa.
Thank you, Madison. I am really excited to be here and to be speaking to all of you about a topic that is very near and dear to my heart. So really this presentation is all about helping families to navigate the school year and is geared towards parents, grandparents, loved ones, but also school staff, social workers, nurses, coaches, or really anyone who is supporting a family who has a parent with cancer and school-aged children. Just 1 second, seems to be a little delay. There we go. All right. The agenda for my time is to introduce you to me and Bright Spot Network, talk a little bit about challenges of a cancer diagnosis, as well as protective factors for families, dig into why you might want to involve the school, and if so, how to communicate with the school and what support resources are available at school. We'll also cover signs of distress and how to maintain balance at home. Madison already gave my introduction, so I really have nothing else to say except for that this really is a passion of mine. Given my personal experience of having a father and stepfather with cancer, I really do enjoy working with families who are navigating this cancer diagnosis. And so in addition to my work at Bright Spot, I also teach at the Sandra Rosenbaum School of Social Work and sit as the co-chair of the Youth, Families, and Cancer Special Interest Group at the Association of Oncology Social Work, where I help to promote best practices with families who have a parent with cancer. So at Bright Spot Network, we work with parents who have cancer who were diagnosed during pregnancy or with young children, primarily ages 0 to 6, who live anywhere in the United States. And our mission is to provide young cancer survivors who are parents of small children with a safe space for individual and familial healing, recovery, and reconnection. Our programs are all free of charge and open to anyone living in the United States. So we have a program called Bright Reads, which provides free children's books about cancer, big emotions, grief, and loss. To families, we offer a Bright Box, which is a curated art and craft box for families who we know that, parents are exhausted, especially when you have young kids and are going through cancer treatment. And it's sometimes hard to find a point of connection with your kids. So we can provide a nice activity that you can do with your kids. There's a picture here of one of our participants making art with her kiddo. We offer a Bright Grant for some financial assistance. We just started an activity group for kids called Bright Club because we know how important it is for kids to see other kids who have a parent with cancer. So we have a group for kids 0 to 5 who come with their parent or caregiver and do the activity together as a parent and child. And then we also have a group for kids 5 to 12. And these groups really, the primary goal is to connect kids to know that they're not alone, to see other kids around the United States, to learn a little bit about cancer, to practice some coping skills, and to have fun. We offer virtual support groups for parents who are in active treatment or early survivorship. We have groups for partners, parents who are stage 4, and we are adding groups as it makes sense for the community. We offer webinars and wellness workshops. We offer family resource navigation to connect families and parents with vital resources. And then our website has a lot of really great resources, including some downloadable PDF handouts. We've got a great new video series on Ask a Therapist with short videos. We have customizable coloring pages and color books, and some really great activities that you'll find online at our website. So we know that a lot of people who are diagnosed with cancer, more and more are younger people and people with children, especially as parents are delaying having children. And so given this it's actually somewhat old now, this research from 2011, that probably now it's closer to 3 million children that are under the age of 18 are living with a parent who has been diagnosed with cancer. And this research really validated what we already knew, which was that children's health and functioning are very closely tied to that of their parents. And the young offspring of these survivors are at increased risk for problems in emotional, social, cognitive, behavioral, and physical functioning domains. This study in particular compared pediatric cancer survivors and children who had a parent with cancer. And surprisingly, the children who had a parent with cancer displayed more anxiety than kids who had cancer themselves. And I think that really underscores how kids with a parent with cancer can feel really in the dark, because well-meaning parents often try to protect and isolate their children, and they don't include them in a lot of the conversations. And unfortunately, that actually increases a child's worry. And like this drawing here, it makes kids worry. And that is why we're constantly encouraging parents to talk to their kids and include them in conversations. We know that cancer turns up the volume of what is already there. So if a family was already dealing with stress in their life, whether it was financial stress, stress at work, relational stress, having a cancer diagnosis doesn't magically make all of that go away. I wish it did. It actually just makes all of those stressors that much worse. So if a family is already dealing with some of these issues, we want to make sure we're connecting them with support. We also know that there are protective factors. So if a family pre-cancer diagnosis had an established sense of trust and belonging, they had strong family and peer bonds, they used emotional vocabulary and expression with one another, just had a good pre-cancer functionality and connection to outside support, that they are probably going to get through this cancer diagnosis much better. Cancer builds resilient characteristics, and certainly if a family already has those, such as empathy, ability to reframe a situation or thought, authentic optimism, internal locus of control, problem solving, humor. If families are already strong in those areas, it will really help them to get through the cancer diagnosis. And if this is something that you're interested in, you could actually go to the Triage Cancer website and dig through past webinars. I did one like 3 or 4 years ago specific to cancer and resilience in families. The greatest gift you can give your children is not protection from change, loss, pain, or stress, but the confidence and tools to cope and grow with all that life has to offer them. This quote comes from Wendy Schlessel-Harpum, who was a doctor and also a cancer patient who had children. And what I hear so often from parents when they're first diagnosed is their first priority is their children, and they worry about how to talk to their kids, how to support their kids, how their kids are going to get through this. And very well-meaning parents will often think about truly kind of how to insulate their children and perhaps not talk to them or include them. But truly, this is an opportunity not only for you as an adult to grow, but for your children as well. And I know that reeks slightly of toxic positivity, and that's certainly not the way I want to go. But research has really showed that while, of course, no one wants to be diagnosed with cancer, there are some real growth opportunities. And the same exists for children who have a parent with cancer. And I've done my own research here in talking with parents and kids, and they say the same. Parents will say, I feel like we were able to prioritize and do what was most important in life, spend more time together. When I talked with older children and teens, they said, I feel like I'm much more mature than my peers. I understand what's important in life. I don't care so much about tests anymore. I care about my relationships and my family. So giving children the opportunity to be a part of decisions and letting them in on information allows them to practice a lot of these resilient characteristics and helps them to grow as a person as well. We know that families are a system. So just some visual representations here. We know that if you tug on one of those pieces of the mobile or a part of that spider web, it's going to shift and move everything. So when a parent is diagnosed with cancer, it doesn't just affect them, it pushes, pulls, tugs, and moves the entire system. So it's so important that we're paying attention to everyone, to the partner, to the children, to the immediate family. Everyone is going to have additional stressors, worries, and needs that they need addressed. So when a child has a parent diagnosed with cancer, you can sort of boil down to these 3 bullet points what they need. They need safe, reliable, and compassionate caregivers. They need consistent routines and expectations, and open, honest, and developmentally appropriate communication. So regarding safe, reliable, and compassionate caregivers, especially for younger kids, we're wanting to be more attentive to issues surrounding attachment for babies, infants, that kind of thing. So we want children to feel safe, seen, soothed, and secured. We're wanting to make sure that kids have all of their basic needs met. So if parents need to be gone for treatment, if they have to travel and be gone for long extended periods of time, we're wanting to create a small, intimate, consistent group of caregivers to minimize disruption as much as possible. I know that it's hard to think about things, parents don't want to think about death, but often it takes something like a cancer diagnosis for them to think about long-term planning. And again, I know that this isn't the bright spot of someone's life, but parents have told me when they've taken the time to actually create an advance directive and decide about guardianship, those sort of things, it really is a relief. It is removing a burden. And so they're actually better able to be present and enjoy their life with kids when they know that there is a plan. And a lot of kids will actually ask about these times, this type of thing. Their questions might be surrounding, especially with a single parent, what's going to happen to me if you die? And while I think all parents, regardless of a cancer diagnosis, should consider these things, I think it's especially important for parents who are facing a cancer diagnosis. We know that children thrive on routines and expectations. When they know what is expected of them, they feel more empowered and they are able to be more present because they're not so worried about the unknown. Schedules can be really important. Think about how you would feel if you didn't have your calendar, your planner, and you had no idea what was happening this week. You would feel a little bit anxious. You would be wondering, like, what's going to be happening next? So if you can give your children some kind of calendar, and for kids who don't read yet, making it with pictures, Mighty and Bright offers some really great sort of pre-made calendars for parents going through cancer, but you don't have to buy one. You can just make one and cut out pictures of, the logo of your treatment center to represent days that you're going to be away for treatment. Or if grandma and grandpa are picking them up from school, you can put these things on a calendar and just do a week at a time. And it really does help to decrease a child's sense of stress when they can see what's coming up the next day. Expectations are also really important to keep consistent. I've heard a lot of, parents saying, oh my gosh, my kids are having to deal with enough already. We're going to let things slide. Maybe I don't care so much about how clean they keep their room or maybe keeping up with homework. But that also creates extra anxiety for kids. I know when I talk to kids, if they say, oh my God, my mom doesn't care anymore that I'm starting to get C's in classes or that I'm not doing my chores, things must be really bad because normally my mom cares a lot about this. So it can really actually ramp up anxiety, and kids thrive on knowing what is expected of them. So when we talk about the school time and homework and routines surrounding school, making sure that you're very clear about, what expectations you still have of your kids is very important. It helps to maintain that sense of balance and normalcy in your family. Open, honest, and developmentally appropriate communication is essential. You want to use short, simple phrases and expand as a child's ability allows for it. Include words that your child will overhear. So use the word cancer, talk about chemotherapy and radiation. As much as possible, try to avoid metaphors, especially with young children who are very concrete thinkers. And you might want to consider planning out your message and practicing beforehand so that as a parent or an adult, you feel really confident in how you're going to talk to your kids. And I know a lot of parents want to wait until they have more information. You know, if they've just been diagnosed, sometimes they want to wait until they have a treatment plan or a little more information about the diagnosis before talking with kids. And that makes sense. Just consider that the longer you wait, the more opportunities they have to overhear things and learn about it in a way that perhaps you don't want them to hear about it. I like to tell parents to be careful of promises because I overhear this so often. A very common promise I hear is a parent saying, "I promise I'm not going to die." And truthfully, that's a lie because we are all going to die. And especially when you're tying it to a cancer diagnosis, it can actually really harm the trust that your child has with you. So I call it the P word. I'm careful of the P word. Be very mindful and intentional about your language and what you're promising with your kids. 3 things that you cannot say enough to your children or teens. Number 1, cancer is not your fault. Nothing you did or said made someone get cancer. And I even have to circle back to this with older teens and young adults who will say, I mean, I know that when I said I hated my dad, that didn't make him get cancer, but I can't help but think that there's a part of me, that anger translated to him getting cancer. Of course, it was at the same time. So even children who've grown out of that magical thinking stage, they can actually feel this way. So you have to just sometimes say it out loud. You do not, it doesn't matter how mad you were. It doesn't matter about your fighting. You did not make your mom or dad get cancer. We want to talk about cancer not being contagious. Try avoid using the word sick in describing cancer, especially now in the world of COVID. It can be really confusing, especially for younger children. So, let your child know that they can hug and snuggle you all that they want, and they're not going to catch cancer from you. You also want to, in general, be inviting of questions because this is never a one and done conversation. This is ongoing. So remind your kids that they can ask you questions now or later. You might have to be the one as a parent to circle back and check in with them and be prepared that they're probably going to want to ask you questions at the most inopportune time, like as you're trying to put them down to bed. That's always when kids seem to worry. And it's okay to just sometimes validate their feelings and say, let's talk about this tomorrow. It's always okay to delay as long as you give them a time that you'll circle back to it. It's also okay to say you don't know because you don't have all of the answers. So be honest and just say, that's a great question. I don't know. I'll find that out. Or, hey, let's find that out together. So if your child is old enough and it's appropriate, start to include them in some of this information. For younger children, like I said, it's about keeping the phrases really simple and just starting to build on that. So this slide just has some very basic sentences that parents can sort of cut and paste together as it's appropriate for their situation. And as kids start to have a better understanding, you can expand on what these things mean. So why involve the school? We're getting back to that time of year where children are going back to school. And I know a lot of parents are thinking about their support team, and depending on where they're at in treatment, perhaps schools already know from last year, or perhaps this is the first school year that you will be having cancer and your children will be going back to school. So, why might the school be helpful? Well, first of all, schools are full of caring adults who really do want to help. Your child spends most of their day here. It's a vital part of their life. And most teachers and school staff do really want to help. Also, by schools knowing, they can connect your child or your family to really valuable resources, whether that's within the school or the greater community. They might have connections and referrals to community resources that would be really helpful. The other thing that I really talk to parents about is that your child may act really different at school. I'm surprised by how common that is. Confusion, sadness, worry, anger might be causing some really big feelings and outbursts at school. And they may also be the cause of some really disruptive behaviors that you have no idea is going on. And of course, teachers and staff are better able to respond to that and understand it if they understand where it's coming from. It could be the flip side too. It might not be disruptive behavior, but it could be that your child gets really withdrawn and isolates and kind of flies underneath the radar. And your child would really benefit from a little bit more attention and support. Your child also might be sharing the news at school, and it might not be accurate. We all know the game of telephone, right? So imagine how children overhearing information at home, and then it goes through their young brain filters, it gets all mixed up, and then is further warped as it gets shared from person to person or from adult to kid. So the more that we let the information be shared by other people, the less it's going to be the message you want. I know a lot of parents feel reluctant about bringing in their school, and they think like, we can deal with it ourselves. I don't want people knowing my business, especially when you're in a small school district and everyone knows everyone's business. You don't want gossip. So there are a lot of real legitimate reasons to consider not involving in your school. But I would just encourage you to ask yourself, like, what is it that's causing a barrier, and how might you be able to address that fear and that worry so that it could benefit not only you, but your children. It's really not uncommon for families to feel uncertain about sharing their cancer with schools because of stigma, worry about being treated differently. They really have this desire to shield their kids and maintain normalcy. But I will say again, if you don't shape the message, someone else will. And remember that you get to set expectations and boundaries. You have the power to share information in your own way and set the rules. You get to share with staff the language you're using with your child about your cancer and what you do and do not want discussed with them. And school staff really do want to hear and meet your expectations. Realize also that there may be families in your shoes. Including the school helps them to understand the situation and how to be a good support to you and your children. The more familiar they are with supporting families like yours, the better they'll be with other families that come after you. So if you're at the point where you're ready to communicate with your school, the first thing I encourage all parents to do is to have a conversation with your child about what they want to be shared. This might not be as relevant with younger elementary school age children, but once your kids are in middle school and high school, they have much greater agency and really should be included in the decisions about what information is shared and who it is shared with. It's possible that you and your kid may disagree, and there may need to be some compromises about meeting both of your needs. And it might require you to bring in a support like a school counselor or social worker who can help facilitate the conversations and discussions. But I think that, that is just the vital first step. Also, these conversations are essential before the child goes to school and possibly learns about the cancer or the details of treatment from someone else, because there might be adults at the school or even kids. Again, sometimes it's amazing how this information spreads and you're not aware of it, where a well-meaning adult may come up to your child and say, "I'm so sorry to hear about your mom's cancer." Oh my God, if you haven't told your child that yet, imagine them learning that for the first time at school. So think about that and play that out. And also, it's helpful to have these conversations so you can prepare your child in how to respond to people. The most common thing I hear, especially for young kids, in elementary school, is if a kid shares that their parent has cancer, it's almost inevitable. Someone in the class, another kid will come up and say, "My grandpa died of cancer. My cat died of cancer." They have, an older person or a pet in their life who has died of cancer. And how might that make your child feel? Especially if your cancer experience is that it was caught early, it's very treatable, and you're going to do well. That might be really scary for your child if they all of a sudden think that everyone dies from cancer. So if you can start to prepare your child and maybe even role play out some responses that they can give to other kids, or talk with them about trusted adults they can go to at school if they feel overwhelmed, or if they feel upset by what another child says, talk about, should they go to their teacher? Should they go to the counselor? Who can they go to when, they're upset by something another kid has said? As a parent, you really do want to identify a trusted contact at school. And it might be someone that you already have a relationship with. That would be great. If you're someone who is especially worried about confidentiality and keeping information private, you may want to consider the school professional that has to maintain that for legal and ethical reasons. So that might be a reason to seek out the social worker, counselor, nurse, someone that's going to really, they've been practiced in keeping confidentiality and following HIPAA. When you meet with this person, be really clear about what information stays between the two of you and what can be shared with other school staff. And I'm sure that there'll be some information that you might want to keep more private, and you're using the school staff actually as a support and a sounding board to actually give you some feedback. And it's not like you want that information shared with everyone. Make a plan for the best communication between school and parents. So as a parent, you can talk to this school staff about, is it best for us to maybe talk once a week by phone or email, or should I just kind of send you an update as things change? What works best? And it tends to be nice when you have sort of one main contact so that you're not wasting your time and energy talking to everyone. It's different if you really do want to have a different relationship with, say, the teacher and then the school social worker. That makes sense. But you don't want to have 10 different contacts at the school that you're constantly having to update. So that's why it's nice to have sort of that one point of contact who can then be a representative at school. You also want to consider updating contacts at school to reflect your care team. So if you will be traveling a lot, if all of a sudden you have, your sister or brother-in-law or a good friend who's going to be picking your child up from school a lot, or who may be a new emergency contact because you will not be reachable, make sure you're making all of those updates with the school so that they know who is someone that it's okay to talk to about this. There are a lot of great support resources at school. So all of the staff in student services, the social worker, school counselor, the nurse, they're all about helping your kid socially, emotionally, physically to feel good at school, and they will be there to help. Some schools have support groups that are specific. You might even have a group for kids who have a parent or loved one with cancer, if it's a large enough school, or maybe they just have a general support group for kids who are going through a tough time. And it's a great place where they can meet up with other kids, learn some coping skills, process their feelings. I know a lot of schools even just have like lunch bunch groups where kids that need a little bit extra attention can get together and have some more special time with the school social worker or counselor. And sometimes that's all they need. And I do think it's important that I mention that most families, by and large, get through this cancer diagnosis without even any extra support, because most families are resilient, kids are resilient, families are able to get through this really well. And some extra support never hurts. So I think that that's why schools are such a great place, is it just kind of bolsters the wraparound support that your child has when they're not with you. Another great thing that you can work out with the school is an invitation for you as the parent or someone from the medical team to give a presentation about cancer and cancer treatment. That's something that I have done working with families, where it's, a young child in a class, and the class just wants to know more about what is cancer treatment, what are good ways to support my friend. This works well in schools if like a teacher has cancer and kids want to know more about it and how to support them. It's a great educational opportunity. So it's also nice for parents who like to control their message a little bit more, that they can go in and really share from their mouth to the class what's going on and what's happening. For some kids who are highly anxious or feel like they have a lot of peers who are asking them questions and they don't know how to answer it, that might be a really great time to bring in a parent to just come in and answer those questions directly. Another great thing that schools can do is make a plan, make individual unique plans with students based on what they need. So perhaps it's working on a plan to have a number of passes, or an unlimited number of passes to go see the school counselor if they feel upset throughout the day. Maybe it is developing a really subtle sign between the teacher and the student that shows that the kid's doing okay, they want to be in class, but they don't want to be called on. I've used that one before, where maybe, they're in a class where there's a lot of participation, and maybe they do kind of like a, thumbs down to the teacher. They get their eye contact, and that says, hey, I'm here, I'm listening, I'm participating, but please don't call on me because I feel really emotional and I don't want to start crying. I think there can be a lot of creative ways to work with teachers to figure out ways that kids can still participate and be a part of class, and still make room for them being a little bit more vulnerable and emotional as they need to feel their feelings. Paying attention to signs of distress in general, you as a parent know your kid the best. I always say, just listen to your gut. If something seems off, pay attention to that. Is something affecting your child's ability to function in their life? A lot of times it comes down to disturbances in the big four. So a regression in development, especially, this is especially for young children, but it could be any age. So if your elementary school age child all of a sudden starts bedwetting, that may be a sign that there is some additional stress that needs to be paid attention. If in school, if they used to be sort of a straight A student and they're really struggling, if they're sleeping too little too much, eating too little too much, if there's a big change in one of those behaviors, just, pay attention to it. And if it lasts for a couple of weeks, it may indicate that some extra support would be good. If all of a sudden your child is like really explosive, or on the flip side, they're very withdrawn and they isolate up in their bedroom all day, again, another red flag. Dysfunctional role shifts. If you have a child who wants to sort of step into a parent role or a surrogate partner role, some of these things are very normal, that they just want to be extra helpers. But if it's sort of, chronic and getting in the way of their ability to just be a kid, then you want to connect them to someone who can help them be a kid, to sort of let go of some of those burdens and remind them that they're not the adult, that they're the kiddo, and that they still get to have fun and play and do the things that kids need to do. So if you do feel like there are some signs of distress, again, thinking about schools and what a great resource they are, I would suggest first checking in with that contact you have to see what referrals they might be able to offer. They might know of some community therapists, family therapists, some cancer support communities. Is there a Gilda's Club in your community, or a different kind of in-person opportunity for kids to be with other kids? That would be great. If you do pursue individual or family therapy, you want to look for someone that is well versed in working with kids and also understands cancer. Those would be pretty important. We know that kids in particular, young kids, they're not going to, sit in a therapy session like adults would. That they really do best through interactive play therapy, art therapy, something that's more engaging. If you have a child who's experienced some kind of trauma that's connected to cancer, such as, maybe they witnessed you pass out or an ambulance coming, you may want to find a therapist who is trained in EMDR, which is a really great approach to help kids process trauma. And then you want to think about just maintaining balance at home. It is really hard, I know, because I've fallen into this, to overschedule kids, because there are so many great opportunities for kids regarding after school activities and sports and music, and kids have a lot of interests. And so it's not uncommon to have an activity every day of the week. I would really caution you about that. Certainly you want to maintain normalcy. And if your kid, if soccer is really important to your kid, you don't want to take them out of it. But are there activities that perhaps you could step away from for a little bit in order to provide downtime? Because that downtime, when kids have nothing to do except for just play, that is when they are able to think and process their feelings. That's really essential to their overall well-being and mental health. It's not interacting with you or siblings. It's really just kind of quiet downtime. Try to schedule that in to their week as much as possible. Try to create touch points as often as you can. And I mean that literally, especially the younger children, it's more important that you're physically hugging and snuggling, reading books, wrestling, something that's like that physical touch. Older kids, that might not be as important, but hey, I think hugs are always great. But you also just want to be able to check in with your kid. How's your week going? How's your day going? When you're a parent and you have lots of kids and you're still working, and then you've added cancer treatment, you're busy. You're really, really busy. And when you're not busy, you're exhausted. So these kinds of natural connection times can fall by the wayside pretty easy. So you may need to actually think about scheduling in times to check in with your kid. You also may want to consider a new routine to keep everyone's stress at bay. I've worked with a lot of families who have used this as an opportunity to start new routines, like at dinner time, we all go around and say something that we're really thankful for during the day. Or, every night now we all practice some kind of guided imagery or meditation, or, hey, let's do after dinner walks and get outside and breathe fresh air. And it's just a wonderful way to all practice some self-care and stress reduction. And also, it reinforces that family cohesion and brings you all together. So I know that this webinar will be recorded and on the Triage Cancer website, which is awesome. I would also encourage you to go to Bright Spot Network, to our website. Under the resource tab, you will find one of our Ask a Therapist videos is about talking to your kid's school. So you can use that video, as well as there's that green download now button, which will give you a free PDF of most of what I covered here. So whether it's that you want to reference it for your own family, or if you're a professional and you want to pass this on to families as a guide, please do that. All of these resources are free and we encourage you to share them. I also want to take this moment to just promote an upcoming October webinar series we have about parenting through cancer. We'll have a webinar about talking to kids about cancer, the power of routines, self-care for parents, which is an interactive workshop, and then an authentic self-care workshop for the caregiver. You'll be able to find more information about those and register through our website. So that is all I have for you today. I will look forward to questions, but I also just do want to make sure that you have my email, and I encourage anyone to reach out with specific questions or ideas, referrals, whatever it is. Please reach out and let me know how I can help.